Myopia in children might be grabbing all the headlines, but adults are also in the disease's crosshairs. Myopia can have a drastic effect on an adult's vision and quality of life too. So what to do? In a recent Cake magazine supplement, a consensus group of 11 world-renowned experts came together to frame the discussion on the current myopia correction landscape, including phakic IOLs. Postoperative care is an oft-overlooked but key part of the ICL journey. The panel's findings heavily stress the importance of early postoperative care after an ICL implant and for the need for the patient to be compliant to follow-up visits.
I check my patients 2 to 4 hours after surgery to check their pressure, and then I see them again the following day looking, obviously at the vault and the angle, the cornea, your incisions, making sure that everything looks good and checking pressure, and assuming all that's fine, then I see them at 1 week, and then at 4 to 6 weeks for a refraction. Most patients, I would say well over 90%, are on target and happy by 4 to 6 weeks, and a lot of them, their eyes are so comfortable because this doesn't really cause much dry eye or anything like that, that at 4 to 6 weeks, really, if they're doing well and their vision is 20/15 and they're happy, then generally we'll tell them, okay, great, at this point, really all you need is an annual dilated eye exam. These patients are myopes, so they still need a dilated eye exam, and I actually make sure to tell them that in the pre-op consult as well. I'm like, we're making it so that you're not having to see your eye doctor every year for glasses, but you still need to see them for an evaluation to check your pressure and to check a dilated exam. And I make sure they really understand that.
I think it's normal to tell patients that their vision may fluctuate a little bit immediately following surgery. It's okay to have a slightly higher pressure. It is something we saw a lot with the Visian ICL, and I think that there still are maybe some holdover concerns from that. The rate of IOP spikes in my practice after EVO ICL is exceedingly low, almost non-existent. I mean, it's incredible. It's a more forgiving surgery than the legacy ICL. And so having EVO ICL really has unlocked just surgeon confidence, especially in our practice.
Communication can go a long way in the journey of a happy ICL patient. The panel stressed that both an understanding of candidate expectations and effective communication with candidates were important in obtaining optimal results from the procedure.
The words I use a lot with patients is it's a reversible procedure. Whenever they ask, can I go back? Yes, absolutely. It's a reversible procedure. One of the questions that I get a lot is it like my contacts that I have to go through exchange every year? No, it's bulletproof, the material, the Collamer. That has been proven track record of more than 30 years inside the eye with zero deterioration of the optical qualities. If you think about it, we are not touching the cornea rather than doing a small incision. 90% are 20/20. 4 hours after the procedure. So the recovery is very fast. I always tell them that they will experience some mild glare at the beginning due to the pass of light through the small aperture, but that truly goes away after 3-6 months. It's very mild and it's very well accepted.
Just like with any refractive surgery, I like to make sure that patients have a thorough understanding of the risk and benefit. Make sure patients understand their options. And if they have more than one option, like if they're considering laser vision correction versus EVO ICL, then you really want to talk to them about the pros and cons of the different procedures for their specific situation. I would say the top things that patients ask me that they want to know about is how much time am I going to have to take off work? Does it hurt? What's my recovery going to be like? So always make sure to address those in the consult, just so there's no question in their mind. With ICLs, recovery is very similar to LASIK. It's a very safe procedure. It sometimes sounds really scary to patients if they haven't heard of it before. I don't want to spend too much time comparing it to LASIK, but I also kind of compare it to LASIK in the sense that I'm like, your recovery time is going to be very similar. You're going to be able to go to work a day or two after your surgery. Sure, they might have a little bit of light sensitivity, a little bit of residual dilation or blur or something like that, but most people find that they're actually quite comfortable by the day after the procedure.
Communicating expectations to patients for any procedure is important, and EVO ICL is no different. It's really a pretty straightforward path. LASIK patients can struggle with dry eye and fluctuating vision. PRK patients have this significantly longer time to heal, a lot of postoperative pain. For ICL patients, it's almost like a cataract surgery experience in a way. It's really comfortable for the patient. It's a very straightforward, bilateral, same-day surgery, and with that comes the excellent vision. Now, obviously, there are risks, and we go through all of those risks, but in terms of what to expect for those patients, it's very similar to a LASIK-like experience.
This video is just one part of our series looking at the guidelines on building proficiency in phakic IOL procedures. Scan the QR code below to access the entire supplement and learn about common practices from some of the world's best phakic IOL surgeons.